The changes wrought by psychoactive drugs and addictive behaviors cause temporary and permanent changes in various parts of the brain that can be viewed. For many years, Dr. Daniel Amen has studied these changes in brain function at his clinic in Fairfield, California, using SPECT scans of the brain.
SPECT studies are very sophisticated nuclear medicine studies that look at blood flow and metabolic activity in your brain, or how your brain works, as opposed to a CAT scan or an MRI. A lot of people have heard of those. Those are anatomy studies.
When the brain is functioning normally, there is an even distribution of function throughout the brain. When drugs are used, many parts of the brain become inactive or occasionally overactive.
This is a person that has serious methamphetamine abuse, about for 8 years. And what we see are these multiple holes or multiple discrete areas of decreased activity across the cortical surface of the brain. What we're looking at are not really holes of brain tissue that if we took a brain out it wouldn't look moth-eaten like the picture looks. What we're seeing is dramatic decreased function of the brain. And what we see with alcohol, this is someone that had been abusing alcohol for about 20 years. What we see is this just dramatic overall shutdown or decreased areas of activity across the brain. My classic marijuana picture, this is someone who had been abusing fairly heavily for about 12 years, and what we see is just this incredible suppression of activity in the temporal lobe region of the brain on both sides, which is going to give him, and in fact did give him, significant problems with his memory and significant problems with motivation.
Mental illnesses, brain diseases, and behavior dysfunctions, including schizophrenia, Alzheimer's disease, obsessive-compulsive disorder, and attention deficit disorder, or ADD, can be viewed in the SPECT scan.
The correlation between ADD and addiction is huge. In fact, they did a study out of Harvard that looked at the incidence of substance abuse in untreated ADD adults, and they found it was 52%, which is, 8 or 10 times the national average.
Those with ADD, as well as mental illnesses such as depression, panic disorder, borderline personality disorder, or antisocial personality disorder, have a chemical brain imbalance and will sometimes use drugs for self-medication.
Most common question people ask me, well, if you've used, and you stop using, what happens to your brain? And for many people, their brain slowly over time seems to pick up function, but it depends on what you use, how long you used, how vulnerable your brain is, because we've seen some brains are very hardy to abuse and some brains are very susceptible to damage.
Before and after pictures reveal the damaging physical effects after 3.5 years of meth use.
Wow.
Pretty bad, huh?
Dr. Cheryl Berman manages Santa Clara County's alcohol and drug rehabilitation program. Dr. Berman showed me photos of the physical damage to the body caused by meth, like these before and after pictures of a user's hands.
This is part of the psychiatric symptoms like delusional, where people think they have bugs under their skin, and so they start scratching away, and they end up getting abscesses on their skin.
And as bad as this looks, Dr. Berman says it pales in comparison to the damage done to the brain.
And the one on the left is the regular brain? This is regular or not regular?
This is regular.
Okay.
And all these kind of grooves and dents and bumps is the brain on methamphetamines.
It looks like it's been beaten.
Yeah, it looks bad.
Wow.
It looks bad.
What am I looking at? What damage? What is this damage?
Well, basically what happens is the methamphetamine affects the neurotransmitters in the brain. And those neurotransmitters are the ones that carry messages about pleasure and sleep and eating. And so all of these kind of nooks and crannies in the brain are basically places where methamphetamine is more or less eating away at the brain.
And she says after a few years on meth, this is what the brain looks like.